Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Pramipexole. Its brand name is Mirapex. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find this information to be valuable, please consider leaving a like on the video as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? We'll start by talking about how Pramipexole works. We'll then discuss indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Pramipexole. We'll then discuss examples of dosing, and then stick around to the end where we'll talk about side effects with percentages. So how does Pramipexole work? Well, Pramipexole is a non-ergot dopamine agonist. The exact mechanism of action is not known. However, its action is believed to be related to its ability to stimulate dopamine receptors in the striatum. In terms of indications or reasons we would prescribe this medication to a patient, we may see it used in Parkinson's disease or in moderate to severe restless leg syndrome, and an off-label indication would be depression. With respect to contraindications or reasons we would not be able to prescribe Pramipexole, we just wouldn't give this medication to a patient who had a hypersensitivity to Pramipexole or any other component of the formulation. Note about dosing with Pramipexole. So in the treatment of Parkinson's disease, using the immediate release formulation, the initial dose would typically be 0.125 milligrams orally 3 times daily. The patient may increase their dose every 5 to 7 days, and the maintenance dose would typically be 0.5 to 1.5 milligrams orally 3 times daily with or without levodopa. In restless leg syndrome, the initial dose would be 0.125 milligrams orally once daily, taken 2 to 3 hours before bedtime. In this case, the patient can increase their dose every 4 to 7 days if needed. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Pramipexole, so I'll go over some of those here now. Orthostatic hypotension, or a sudden drop in blood pressure when going from a seated to a standing position, may happen up to 53% of the time. 4 to 14% of patients may experience constipation, while 11 to 28% may experience nausea. 4 to 6% may experience amnesia, and asthenia, or abnormal weakness, may happen 3 to 14% of the time. Confusion may happen 4 to 10% of the time, and 2 to 26% of patients may experience dizziness. Up to 11% may experience a dream disorder, and 17 to 47% of patients may experience a dyskinesia. Extrapyramidal movements may happen 28% of the time, and a headache may happen 4 to 16% of the time. 4 to 27% of patients may experience insomnia. Somnolence may happen 6 to 36% of the time, and 5 to 17% of patients may experience hallucinations. Now, some more rare but serious side effects would be heart failure or a disturbance in thinking. That's all we're going to talk about today with Pramipexole or Mirapex. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.